Hi, my name is Sarah McCrea, and I'd like to tell you a little bit about myself and my quest for courageous innovation in public services. I joined the fire service over 20 years ago as a firefighter trainee. I had no experience in fire or emergency medical services, but always knew that I wanted a career in serving others. I spent over 15 years of my career in various roles throughout the department, including firefighter, paramedic, fire engineer, hazardous materials technician, and technical rescue technician, experiencing a wide variety of ways in which public services meet the needs of their community on a daily basis. Because of the way in which 911 services work and the reasons for which people use them, first responders have a very intimate and accurate sense of the needs of their community. When people need help, when they are at their most vulnerable, when they don't know where else to turn, they call 911. First responders arrive no matter what and do their best to be of assistance. After years of responding to these calls for service as a first responder, I recognize the limitations of the first response system in making lasting and permanent impacts for callers with more complicated and chronic social, behavioral, and medical needs. Approximately 5 years ago, I transitioned into an administrative role and became the Emergency Medical Services Quality Improvement Coordinator. In this position, I began gathering and interpreting our data and confirming that I was not alone in my experience. I began networking with other public service providers, engaging in interdisciplinary discussions and working groups, and formulating plans and procedures for filling the gaps. One of these initiatives included the founding of Southern Nevada CHIPS, a private nonprofit that began as a partnership between the fire department and local university's School of Social Work, connecting social work students in practicum placement with the vulnerable community members identified by first responders. The program expanded into multiple local fire departments as well as local universities, nursing, and pharmacology schools. Through grants and contracts, Southern Nevada CHIPS continues to provide follow-up social services including navigation and advocacy, preventing unnecessary activation of the 911 system, and improving community health and well-being through improved access to and navigation of the health and human services. Another of these initiatives was the establishment of the Nurse Call Line, an innovative element of the Fire and Medical Emergency Dispatch Center of Southern Nevada. For 911 callers with low-level medical complaints or questions, rather than sending first response resources, they are redirected from the 911 call taker to a registered nurse that provides additional medical triage and information, preventing unnecessary emergency medical resource deployment and utilization of the emergency departments, reducing the cost of healthcare and first response operations. If we want to improve the health and well-being of our community, reduce the cost of healthcare, and ensure efficient utilization and management of public services, we need to embrace change. We need to be courageous and innovative. Join me, Sarah McCrea, today in courageous innovation in public services for a better tomorrow.